My name is Alicia Johnson. My pronouns are she, her, and hers, and I am the director of the Women's Center at UW Oshkosh. I felt like it was a really important conversation to have. I had the pleasure of hearing this information from Lindsey at a local AAUW meeting, and I felt like it was very urgent to bring this to campus, as some of the data that you all will be seeing, I imagine, includes our students and also our larger community. And so wanted to open up the conversation about how we can support the efforts, both for our students and for the larger community as well. So before we get started, I just want to take a moment to acknowledge the land that we're on. So as we begin this event, we acknowledge the original inhabitants of this area, the Menominee and the Ho-Chunk nations. This land encompasses the 3 campuses of the University of Wisconsin-Oshkosh in the Lake Winnebago region. Please join me in taking a moment to honor these ancestral grounds and celebrate the resilience and strength that all Indigenous people have shown worldwide. Thank you. All right, Lindsey, I will turn it over to you. So Lindsey is with the Winnebago County Public Health as a community health strategist. She also happens to be a UWO graduate student as well in our public administration program, and among other roles is a city council member as well. And so here today officially as part of the community, the public health department, but is also a wonderful leader in our community. So thank you for being with us today.
Yeah, thanks, Alicia, for having me and inviting me. I'm really happy to be able to share some of the information I've learned over the past about year and a half that I've been focusing on housing issues in the health department. And I'm excited to hear from you all too. So I will go ahead and share my screen and expand this. So again, like Alicia said, my name is Lynnsey Erickson. My pronouns are she, her, hers, and I'm a community health strategist at the Winnebago County Health Department. And if you don't know what a community health strategist is, that's okay. Basically, what we do is focusing on addressing community issues so that people have the opportunity to live their fullest life and be healthy. So we focus a lot on kind of policy systems changes within the community that have impact on people's lives. So I'll be sharing kind of what I've learned so far. Housing is a very complicated issue. So I'll preface this and say that I will forever be learning, uncovering more data, just kind of understanding the nuances of what's going on in our community related to housing. So I'm more than happy to have a conversation with you all at the end of the presentation and try to answer any questions that you might have. So feel free to add any questions or comments you have in the chat as you think of them, and we'll get to them at the end. So we'll get started. So kind of the roadmap for today, I'll be talking a bit about kind of what about housing? What's the connection between housing and health? And then I'll be sharing some local data, the data kind of telling our story in our community. I'll be sharing kind of what the COVID response has been with housing in our community. And like I said, I'm still learning. There's a lot more data that we need to kind of uncover, and we have a lot of unanswered questions. So I'll share a little bit about kind of questions that I have for this and future directions, and we can do a bit of Q&A and conversation. So to kind of ground this, when we think about a healthy community, a lot of times when people think about health, they might think about kind of the usual suspects, you know, nutrition, healthy food, physical activity. But when we think about health, it's a lot bigger than that. It's do people have access to transportation options to get them from point A to point B, from their home to their doctor appointment to work? Do people have access, like we'll talk about in a bit, to affordable, quality, stable housing? Do they feel safe in their community? Do they have access to jobs that can support them and their families? And and live to their fullest potential? Do they have access to green space and parks? Do they feel connected to their community? Do they feel like they belong? So these are all different elements that add to the puzzle of being a healthy community. And throughout all of that, we focus on incorporating health equity. So health equity is when every person has the opportunity to achieve their full capabilities and potential for health and well-being. So kind of focusing on certain groups of, certain groups of people that may not have access to some of these things. And we may need to work with them and listen to what they need and address those needs. So when we move into housing, I think about housing and health in kind of three elements. So I'll go through each of these. The first one kind of is, the one that we think about a lot with its connection with health. And I should back up and say that housing is a major determinant of someone's health. And what I mean by that is determinants of health are kind of the conditions or the social, economic, environmental factors that impact someone's life. So all of these three things that I'll be sharing are all very intertwined. And as we'll talk about, are kind of turn into a vicious cycle for some folks. So quality housing, this is housing that provides a safe and healthy living environment that is structurally sound and free from hazards. So quality housing, there's lots of research and documented effects on how this affects physical health. So poor quality housing that can contribute to acute and chronic health problems. If you have pests or mold in your house, that could cause or exacerbate respiratory conditions like asthma. If you have exposure to lead, maybe through lead paint or lead dust, that's something that we deal with a lot here in Oshkosh. That can cause some very severe harms to children, to their development in their brain and nervous systems, and their safety issues, like broken stairways, handrails, broken or missing smoke detectors. All of these things could potentially lead to fires, injury, or death. The next piece, and this piece I've been focusing a lot on, has been housing stability. So that means having a regular place to live and having control over if and when you move. So moving is stressful. For any of us who've ever moved, it's a stressful time, even in the best circumstances. But when you have to move frequently, or if you're being evicted, that really throws people's lives and health into just complete turmoil. So it's especially harmful to children's well-being and educational outcomes. It might mean that kids have to miss school or change schools frequently, which can really affect their long-term education or health outcomes. In its most extreme form, housing instability can mean experiencing homelessness, which that in of itself can lead and be associated with lots of health issues. And having an eviction filed against you can stay on your record. I'll talk in a bit about CCAP, but it can stay on your record for 2 to 10 years. So this can lead to kind of long-term ongoing housing instability and that chronic stress for folks. Then the third piece is housing affordability. So that's ensuring that people can pay their housing costs while still having enough money left over to cover basic needs like food, utilities, healthcare, and all the other things that we kind of need just to live and survive. So falling behind on rent payments, that's associated with higher stress levels, mental health conditions. My voice is a little hoarse today, excuse me. That in turn can cause chronic stress. So that's associated with, development of chronic health conditions. That's like, heart disease, diabetes, cancer, and children who are living in households that struggle to make rent. They're also more likely to experience anxiety and depression themselves. So these three factors all tie into each other and are all deeply intertwined in how they affect health. So moving into looking at what our community needs. So the housing continuum, this is a range of housing options, everything from emergency shelters for folks who are unsheltered, all the way up to home ownership and everything in between. So every part of the housing continuum serves a unique need in the housing market. So there's not a one-size-fits-all solution or answer for everyone in the housing market. And ideally, we need to have all of these options in the community, all of these options that are affordable for residents in the workforce that we have. So as you can kind of see in the diagram, you know, having emergency shelter up to transitional housing. So these are folks who are kind of coming up from the next step out of shelter. There's more supports for them there. Or this might be for folks who are coming out of mental health or substance use treatment and who are trying to figure out how to live in recovery. Then up to social housing or kind of permanent supportive housing. This is affordable rental housing that is also combined with kind of supportive services. So making sure that people can have the tools that they need to live as independently as possible. And then all the way up to having affordable rental housing, affordable home ownership, and then market rate rental housing and home ownership. So we need all of these different pieces available in the community to address very unique needs that we have in our population. So next I'm going to share a bunch of data. I'm kind of a data nerd, and hopefully I can help tell the story of what we're seeing, kind of at least as far as what we know so far here locally related to housing stability and affordability. So looking at the number of evictions that have been filed within the court systems each year, we know this has been increasing in Winnebago County over the last few years. So this data is all pulled from the Wisconsin Circuit Court Access, also known as CCAP. So this is all publicly available data that's directly generated by the court system when cases are filed. So these are eviction filings. So this includes cases that were dismissed. So maybe the court system sided with the tenant. This also includes cases where an agreement was reached between the tenant and landlord. And this also includes cases where the court system sided with the landlord and an eviction actually occurred. So this encompasses all three. Adding in where we're at so far, as of this morning, actually, I just checked. This is where we're at for 2020. So as I'll share in a bit, 2020 obviously has been an interesting year. There's going to be a giant asterisk next to 2020 in the data as we look at it, but this is where we're at so far. And I think the story really matters about in the next coming months and years what this data is going to look like. And I'll share too, you know, COVID and its effect on housing, it's not kind of a one and done effect. It's going to be a series of kind of aftershocks, and it really depends on how we respond to that. So comparing Winnebago County to the other counties surrounding us that we typically kind of get lumped in with, Outagamie and Calumet counties, this shows the formal eviction filing rate of the three counties. So this kind of levels the playing field because obviously Calumet County being smaller doesn't have as many renter units, but this is looking at the rate per 100 renter occupied units. So Winnebago County is that top line in green. You can see compared to Outagamie County and Calumet, we're still higher with our eviction rate. And all three counties have been increasing over the past couple of years. So this looks at the average number of evictions filed monthly in Winnebago County. So kind of looking across the year, where do we see the highest number of evictions? It's the summer, usually kind of around 60 evictions filed. This is from 2016 through 2019. So around 60 in the summer and then goes back down in the winter. But this is the average number that are filed each month. So So now looking at 2020, there's been a lot of fluctuation in evictions filed throughout the year because of COVID and because of the various eviction moratoriums. So you can see kind of how it's ebbed and flowed. I'm going to add in where the eviction moratoriums have kind of taken place throughout the year. So here in Winnebago County, we've been through or going through 3 different eviction moratoriums. So once COVID first hit in March, the state enacted the statewide eviction moratorium that applied to all renter properties in the state. You can see there are still some evictions that were filed, but no evictions actually went through the court system during this time. And then the CARES Act was enacted end of March through July. And this eviction moratorium only covered those who were paying their rent using federal assistance. So that might be public housing, the Housing Choice Voucher Program, low-income housing tax credit properties. So anyone who was using federal assistance, or anyone who was in a property that was federally financed or had a federally backed mortgage. So this was a specific moratorium only for certain groups of people. And then the last eviction, now CDC eviction moratorium enacted in September is set to expire the end of the month, end of December. And for this one too, it does require tenants to meet certain criteria. So there's a long list of criteria that tenants have to meet in order to qualify for this moratorium. Some of it includes that they say that they've tried to get other assistance to pay their rent, that they've earned less than $99,000 individually in 2020, or that they got a CARES stimulus check, that they can't pay their rent because they lost income because of COVID, and that if they were to become evicted, they would become homeless. So the current eviction moratorium kind of places the onus on the tenant, the renter, to meet certain criteria, and then they have to or sign a declaration form that's available on the CDC's website, and then provide that to their landlord, and then they wouldn't be able to be evicted. None of these eviction moratoriums canceled rent for anyone, so people still have to pay rent as much as they can. And we're kind of seeing the aftershocks of this. Landlords still had to pay their mortgage, so there's this, this conflicting, people lost income, can't pay their rent, but landlords still have to pay mortgage. And there's going to be this ongoing nature of COVID, especially if you're an hourly employee, if you don't have paid sick time, if you don't have childcare, or you are responsible to provide care to someone, if you're out of a job. There's so many circumstances that have affected folks. And I think we're going to be seeing the effects of this long into 2021. So looking at next, some data about housing affordability here in Oshkosh. We know that 44% of renters in Oshkosh are housing burdened. That means that they're paying more than 30%, more than a third of their income on housing costs. That's data that came out of the East Central Wisconsin Regional Planning Commission last year. We also know that by 2030, Oshkosh has a projected population of about 71,000 people. So in order to meet that demand, we have to create about 155 units per year over the next 10 years. So there's housing shortage, and given our population growth, we have some work to do. And we also know that Oshkosh has a deficit of affordable units for folks who are of very low income, so people who are making less than $25,000 a year, and for folks who are of high income, people making $75,000 a year. So this kind of creates sort of a housing musical chairs. So when housing supply is limited, people with higher incomes are able to kind of bid up the rental or the housing prices in order to actually get that unit. And so what that leaves, the people who are left kind of without a chair in the game of musical chairs, are the people of lowest income. So they end up having to double up, maybe live with a friend or family member, or if that's not possible, find space at a shelter or live unsheltered. So this is the circumstance that we're in and that lower income families are facing. Here in Oshkosh and Neenah, the fair market rent for a 2-bedroom apartment is about $787 a month. So in order to make that affordable, so in order for that to be about a third of the income, they would $15.13 per hour, about $31,000 annually. But for someone who's making minimum wage, $7.25, in order to afford this 2-bedroom apartment, they would have to work 81 hours a week to be able to afford that. Yes, we are kind of in a better spot than other communities across the country as far as affordability goes. But do we have jobs that provide wages for folks to be able to afford this, and having a deficit of units for certain populations and income levels? We have a greater burden. So I threw a lot of data at you. Hopefully you could digest some of it, and I'm happy to go back through. But next, moving into kind of what the COVID response has been, both at a state and local level, to try to provide assistance to folks who experienced a loss of income because of COVID. So the Wisconsin Rental Assistance Program, or WRAP, that was enacted through the state, and that provided payment up to $3,000 per individual in a combination of either rent payments and or security deposits if they had to move. So here locally, Advocap was the agency to roll that out. They spent about $1.5 million in their service area. So they cover Winnebago, Fond du Lac, and Green Lake counties. And as of the last report out that I received, this number increased since then, but provided assistance to 623 households in Winnebago County. So that funding had to be spent by November 24th, and the state has spent about $35 million on the program. But we know that the need continues, and this program did also have certain income limits and other guidelines. So we'll see what we can come up with to continue addressing this need, because again, even though we have eviction moratoriums, rent is still due. And so for folks who might be behind on rent, once the moratorium lifts the end of the month, they have to figure out what to do, either come up with an agreement with their landlord or potentially face eviction. The county also created their mortgage and foreclosure prevention assistance. So this provided up to $2,000 per household for anyone who is behind on their mortgage because of a loss of income because of COVID between March and August, and applications ended in October. So that was a program that was implemented to help support people in home ownership. And this is a group that I've been a part of since COVID, and this group was formed before COVID for a few years looking at eviction prevention, but now we've really hit gotten some momentum and some fire to really work on this and focus on what can we do long term. So the Winnebago County Eviction Prevention Task Force, we're a group that reducing the number of evictions filed in the county and working to improve housing stability. So over the summer, when we began meeting, we really addressed some immediate needs. So we were looking at making sure that people had the information they needed about the eviction moratoriums and the rental assistance program, along with other kind of resources for tenants and landlords. And now we're kind of moving into a phase of looking at what's the long-term policy and systems changes that we can influence and affect to have better housing stability throughout the county. So we've left partners at the table: Winnebago Conflict Resolution Center, the City of Oshkosh, Rent Smart, We have the Winnebago Apartment Association. That's a group of landlords in the area. We have representation from them. Legal Action of Wisconsin, who provides free legal advocacy for folks. Myself representing the health department, forward services, and AdvoCap. And our goal is to really incorporate more community and tenant voice in this discussion so that we can really understand what tenants are going through, how is this affecting the community, and what's going to work. We can assume that we know what the answers might be, but we need to really understand directly from tenants what they're going through. So moving back, kind of wrapping this up, again, showing this is really the vicious cycle that folks are in of quality, stable, and affordable housing. So when people are experiencing serious problems with housing quality, that might drive people to move more frequently. To move, it increases their likelihood of having to move into lower quality housing. And then when rents are high compared to how much money people actually earn, they might have to settle for lower quality housing. And then when the only decent quality housing is expensive or past their income, it can really strain people's household budgets. And when rents are high compared to wages, it makes it harder to keep up with the rent, and that can lead to potential eviction or having to double up or homelessness. So when people are forced to move, it can create this ripple effect of job loss, and then which in turn makes it harder to find and afford housing. So it's really this vicious cycle that folks are in, that all of these three factors kind of intertwine and can create really difficult circumstances in our community that we're experiencing, have been experiencing before COVID, but even more so right now. So, like I said, there are still lots of questions about what's going on in the community. I think questions that I've had, I think we need to really dig into data that looks at specific populations. So how is this affecting families or people of low income, households with children, Black, Indigenous, people of color, refugees, all of these groups in our communities. We need to dig into the data and understand how this might be affecting them. And knowing that we're a university town, what are students experiencing? How does student housing play into all of this? Also, is this an issue of wages, or for folks who are in temporary employment, who are kind of having to have this unstable employment without, any kind of long-term stability? Is that the issue? And what are the conditions that are really leading to unstable housing here locally? And we also have lots of gaps in the housing continuum, and especially in transitional housing. And from my perspective in public health and some of my colleagues who work on substance use issues, we have a real need of having more sober living options for folks who are coming out of treatment and need some sort of supportive housing to help them live in recovery. So we have a lot of work to do. And I'm excited and glad to see how community partners have really gotten together to figure this out. I think as horrible as COVID has been for everyone, it really has put a spotlight on these issues and forced us to act quickly and collaborate and figure out solutions. So I will end it there. And if there are any questions, I'm happy to answer those, or if you have comments or thoughts, I'd love for this to be kind of a conversation. And if you want to reach out, I'd love to hear from you. Feel free to email or call, and I'd love to learn more. So with that, I will open it up.
Thank you so much. Yeah. So if folks have questions, you can put them in the chat. Or Dr. Ford?
Yeah, just real quick, you mentioned in the one slide about the future data questions. And I'm just curious who you think is best positioned to gather that data and analyze that data. Should that be the county, the city, university, all the above?
Yeah, that's a good question. I think it depends on kind of what our scope is. I think we all have a piece in collecting this data. I think for us at the county and me within the health department, that does provide a bit of a different perspective to collect that data. But I think we've seen like the most benefit from when it's collected within a coalition like we have with the Eviction Prevention Task Force. I think we'll be focused on figuring out how to partner with other organizations to collect that. I do think that the cities are also in a position to be able to collect that data, but it's thinking through who has access to some of these pieces, who already have relationships with some of these populations, and who's best kind of situated to collect and interpret this data. So I think it's kind of wide ranging. I don't think it falls on one organization necessarily, but it's kind of coming together and putting all of these pieces together. Does that answer your question?
Absolutely does. Thank you.
Yeah.
Say, I wonder if I could, this is Tina Haefman. I wonder if I could help answer that question too, Mike. Up in the northern Winnebago County, Levin serves that. And you know that I'm the big proponent of Levin, but Levin serves that. So the information that one of the Levin provides for the community that's so essential is that the information it gathers about the people that it's serving is so complete. It's so, it lets the community know. I mean, they talk to 80 people a week in desperate situations, about 75% of them in deal with housing. So it's mostly housing issues that they talk about. So an organization put together like Levin can tell you how many people it is that are not making wages that are adequate, how many people cannot get affordable childcare, how many people have a disability and can't get on a housing authority list. They can show you all of those things. So it's another plug for an organization in Oshkosh to be put together in a Levin type form. One of the, besides helping 11,000 people in 2019, they also are able to provide the community and all the community government entities with unbelievably valuable information. So that's my little soapbox for Go Levin today.
Yes, yeah, Levin does some great work, and I think that's really important to recognize kind of within organizations who are they serving and what stories are they hearing, what can we learn from them. And I'll stop sharing so I can see people's faces. Hey.
Austin?
Hi, thank you for speaking with us today, first off. What kind of things can students do to help out help out with this problem, help out with the homeless community? Like, is there any like local volunteer options that we could do or apply for?
Yes, definitely. So I think the first step is just learning this information and learning what the need is, and then working to understand what do we have available in the community for folks who are unsheltered. So here in Oshkosh, we have 3 shelters, Day by Day Warming Shelter, Father Cars, and Christine Ann Domestic Abuse Services also provides shelter. So I know all 3 of them are in need of, whether it be donations or items or volunteer hours. I would definitely recommend reaching out and learning about their organization. I know for Day by Day, they have some regular kind of volunteer training times to train volunteers. And they're currently in their season of service. They open mid-October through mid-April. So I would recommend kind of doing some research and reaching out to those organizations. Anyone else want to add anything to that? Did I missed anything?
I added the links to those 3 organizations in the chat.
Oh, nice. Thank you.
Lindsey, what do you see as the responsibility of employers? So for example, calling out my own employer, UW Oshkosh, I know that we have employees who make less than that $15 an hour number that you shared as being affordable. So, you know, what can UW as an employer and other employers in Oshkosh and the region, what can they do or what should they do?
Yeah, well, I think employers are starting to be part of the conversation more, which is encouraging. I think recognizing that wages and employment plays a huge role in all of this. And if we have employers who have employees who aren't able to afford the housing and live in the community that they work in, that can be an issue both for their being able to attract new employees to come and live in this area and be able to retain employees and have kind of long-term employment. That's a huge issue. So I think for employers to recognize their role in all of this, and it benefits them to have to be part of the housing conversation and make sure that a community that their employees live in can actually support housing them. So I know there's been some work in other communities. I think Sheboygan has done some work on workforce housing, and for communities who have a lot of tourism in the summer. Door County has done some of this work too to try to provide workforce housing for employees, especially during those peak times. And yeah, I think there can be some creative solutions, whether it's that or just trying to make sure that they can support employees to live in the area. Yeah. Good question.
Thank you. Lisa?
I have actually, my question is regarding housing safety. You had mentioned in the beginning about, lead exposure and asbestos, things like that. And I kind of wonder, like, what are we doing as a community to help people, in those housing? Like we talked about, how if you, get evicted, you move and maybe you're able to buy a house, but it's a lower. Do we have programs regarding like removal of asbestos, lead, because that can be extremely expensive for people? And, are there grants available, things like that? Because I think, we have to look at this approach as, how do we keep people in their houses, and so it comes down to financial and, community, all of it. And I'm curious as to what is available.
Yeah, that's a really good question. So I can speak for the health department and kind of what our role has been in lead work. So we do have environmental health staff who they provide environmental lead assessments, paint sampling, go in and inspect homes. When we get a report of a child who tests with an elevated blood lead level. And then we have public health nurses who go out and provide case management and education. And our environmental health staff also do consultation with residents and business owners to try to figure out how do we reduce the contamination in their homes and buildings.
Okay.
But there's definitely work to do on the side of lead remediation. That's an issue where we don't have many contractors who are able to provide that in this area.
Okay.
Pre-COVID, the state was rolling out some funding to provide that training to contractors so that we could get more remediation in this area. But that's a big need for sure.
Right.
And especially since we have a lot of older housing stock here.
Right. And that's just my concern. I knew some people who lived in a house with like asbestos. They didn't have a clue, and both of them developed like a lung cancer. And so I guess my thought was, and it's great that we have these things, like once the child is tested positive, but sometimes I wonder if it would be wiser for us to be doing more prevention instead of, reaction.
Mm-hmm. Yeah, you're exactly right. Yeah, we have a lot of work to do on that area.
For answering.
Yeah, no, thank you for bringing it up. It's important.
Lindsey, I'll share the link in the chat, but could you share about the rental inspection program?
Sure, and I think there might be some other city folks on this too that could probably explain it better than I can. But basically, the rental inspection program is through the city, where renters can they have to voluntarily agree to have an inspector come in, and there's a checklist that they go through, looking at certain kind of safety issues, looking at are there fire alarms that work in the building? Are there the handrails, and sometimes looking at I think typically on average within the city, they see about 6 violations per inspection. And so there have been issues related to safety, but it is a voluntary program, and the city does some outreach to specific kind of districts within the city, especially during kind of move-in time for students, so that they know that if they have any concerns, they can have a city inspector come in and go through, and then the inspector does provide that information to the landlord to work on some of the issues. So.
Thank you. Yeah, I thought that was a good opportunity to connect to Austin's question earlier about what can students do, and that's one thing that you can share about with others is to know that you have rights as a renter and that you have a right to a safe house.
Right.
Just because you're a student doesn't mean that you have to live in an unsafe or at-risk housing unit. And so like helping amplify that resource is one.
Yeah. Yeah, and if anyone has questions, they can always call the housing inspector for the city. And if someone does request to have an inspection, they can't be retaliated against by their landlord. So renters have rights to make sure that the housing that they're living in is safe. And I'll put in a plug too, for the city, there is a rental housing advisory board. So if anyone is interested, anyone who's a renter or just interested in these types of issues, we meet typically, I think every other month. We have a meeting coming up actually, I think next Wednesday. So you're welcome to, it's all virtual now, but you're welcome to listen in, and there is a public comment time that if you want to provide any thoughts or experiences or questions. And I think at our next meeting, we'll be talking about a tenant bill of rights too. So speaking of rights for renters. So anyone's welcome to that meeting. It's on next Wednesday, the 9th at 3:30. So there's more information on the city's website.
And I just put the link to the board in there.
Nice. You were just like on it.
Looks like Bob might have a question.
Sure. It's not necessarily a question. Maybe it's just a clarification of what exists for students. As a graduate of UWO and involved in Oshkosh Student Association, the government association, I went to college knowing that if I had issues with my landlord, whether it were, eviction-based issues or inspection-type issues with my landlord, or just general housing issues with my landlord, I knew that I had of UWO legal services through the Student Association as well, in a very affordable fashion. So that's one of those things that if you need a little extra teeth to getting your issues taken care of as a student, you have access to that a little bit easier than someone out in the community might have access to that. So, and that, you know, and that pays for a lawyer to advocate for you, to write letters for you, to go to court for you, if you need to. So, so that's, I mean, that's there for, last time I knew that was there for excuse me, for students. So just wanted to plug that.
Thank you, Bob. Yeah, I put the link to that in the chat as well, and I'll drop the link to legal action or legal aid. There's an Oshkosh office as well that can help.
Yeah, and for legal action, you can always just call. They have a general number. And if you ever have any legal questions too, they can help walk you through that, or about the current eviction moratorium. Yeah, I think Bob brings up a great point of you need to be able to provide tenants with legal representation, because you know the eviction process is really overwhelming for folks, and a lot of folks don't have representation. So as a student, you do have some resources.
I will also share from like an academic success perspective, you know, to help us think about like a student who might experience eviction. Obviously, if you're being evicted, you probably aren't going to be able to keep up with your work, your classes. And so, you know, while there's support on campus, you could always reach out to the Dean of Students, the Women's Center. You know, there's lots of advocates on campus, but it still takes a toll on your ability to pursue your education. And so, it, you know, just trying to make all of those connections for folks like that there are students who do experience eviction and who experience homelessness and housing instability. So that's another kind of question to put on the exploration list for the group.
Yeah, definitely. That's good.
Other questions for Lindsey, and or questions that we might want to suggest that the group into housing issues in Oshkosh or in Winnebago County? Just to clarify, before we conclude this event, Lindsey, do you want to share why the demographic data isn't readily available for the evictions?
Yeah, so the data that we pull from CCAP, Wisconsin Circuit Court Access, does not provide demographic data. So that's going to require a little bit more digging or working with the courts to try to pull that. So the data that they provide through CCAP is just kind of pure numbers of filings. So yeah, more work to do on figuring out if there's any trends with certain populations or who it's affecting more in our community.
Thank you. All right, any last questions or last comments? All right, well, thank you all for joining us, sharing. I hope that you're able to take the information that Lindsey shared and help amplify the message, find ways to get resources to folks who might be experiencing housing instability. And, you know, if you do come across folks who are worried about eviction or are experiencing housing instability, please connect them to resources and help share that story so that we can get a better and more comprehensive picture of housing and health in Winnebago County. So thank you, Lindsey, for joining us, and I hope everyone has a wonderful day.
Thank you. See ya.